Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it. The disease has struck hard in 3 countries, Guinea, Liberia, and Sierra Leone, which is the epicenter. A Liberian government official who had flown to Nigeria's largest city, Lagos, died of the disease in a hospital there. 2 American aid workers infected in Liberia, 33-year-old Kent Brantley and 59-year-old Nancy Wrightball, will be sent home for care at Emory University Hospital in Atlanta. It is the first time any Ebola patient has been sent back to the U.S. for treatment. This afternoon, Dr. Bruce Ribner of Emory said there was no cause for alarm among the public.
From the time the air ambulance arrives in the metropolitan Atlanta area, up to including being hospitalized at Emory University Hospital, we have taken every precaution that we know and that our colleagues at the CDC know to ensure that there is no spread of this virus pathogen.
Well, I'm going to ask you a little bit more about that judgment, because one of your colleagues is being quoted by the Associated Press as saying it's totally out of control. That's a terrifying remark.
It is. I would say rather that it is not yet under control. We managed to control some of the earlier satellite outbreaks. We've had new ones. These are going to get brought on.
Well, I'm going to ask you a little bit more about that judgment, because one of your colleagues is being quoted by the Associated Press as saying it's totally out of control. That's a terrifying remark.
It is. I would say rather that it is not yet under control.
Warned Americans not to travel to the affected countries unless necessary. Dr. Tom Frieden is the director of the CDC. He joins me now. So, first off, what can you tell people to assure them that this disease will not spread to Atlanta or other parts of the United States as we bring these patients back?
Well, first off, it's really important to understand how Ebola spreads and how it's spreading in Africa. The outbreak there is the worst we've ever seen. But Ebola doesn't spread from people who don't have symptoms. So if you have contact with someone who is exposed but not sick, you can't get it. And second, Ebola isn't spread by casual contact. It's not spread through the air. It's spread through body fluids. That's
On the other hand, you need really close contact to become infected. So just being on the bus with someone with Ebola, that's not a problem. It's also not aerogenic, so it's not transmitted through droplets and so on.
Why is it larger this time?
Well, the thing that's different this time is the mobility of the people involved. Ebola is spread through close social contacts, which means that if it stays within a geographically limited area, the number of people that you come into contact with that will attend your funeral or take care of you is reasonably small. These people move about a lot, so that when they become exposed to Ebola in one location and then move 50, 100, 150, 600 kilometers somewhere else, and then become sick there, then we have to deal with a whole new satellite outbreak over there.
Alright guys, I found this wonderful news article online that would prove that Ebola does spread on any type of contact. Even if you're not close to the person, it still can go on to you. This is an airborne virus. I can prove to you that. I'm going to give you the link to this article below the description, below in the description box. Ebola, what you're not being told. Update, August 13. There is something very, very important that the corporate media and public health officials are not telling you regarding the Ebola outbreak in West Africa. The information I'm about to present here is frightening. This is really no way around that. However, I request that you do your best to maintain a calm state of mind. Right now, West Africa, the worst outbreak in history, is in full swing and is jumping borders at an alarming rate. Already, it has spread to 4 countries. So this thing has spread to 4 countries. That is pretty amazing for the news to say it's under control. This is not under control. Okay. Let's continue. Alright. It says right here. I'm going to mention the 4 countries. It's Guinea, Liberia, Syria, and Leon. I think that's how you pronounce it. And now Nigeria. The latest jump into Nigeria is particularly serious since the affected individual carried the virus by plane to Lagos, Nigeria, a city with a population of over 21 million. Doctors Without Borders has referred to the outbreak as out of control. So they're trying to kill over 21 million then. That's a lot of people. Remember, the New World Order has in the Stonehenge, they want to eliminate a lot of the populations. Okay. Next one, to make matters worse, there is something very, very important that the corporate media and public health officials are not telling you regarding this crisis. You notice if you read virtually any mainstream article on the topic that they make a point of insisting that Ebola is only transmitted by physical contact with bodily fluids. This is not true at all. A study conducted in 2012 showed that Ebola was able to travel between pigs and monkeys that were in a separate cage and were never placed in direct contact. Okay. Though the method of transmission in study was not officially determined, one of the scientists involved, Dr. Gary Kohlberger from the National Microbiology Laboratory at the Public Health Agency of Canada, told BBC News that he believed that the infection was spread through large droplets that were suspended in the air. What we suspect is happening in large droplets that can stay in the air, but not long. They don't go far, he explained, but they can be absorbed in the airway, and this is how the infection starts. And this is what we think because we saw a lot of evidence in the lungs of the non-human primate that the virus got in the airway. So when they sent these 2 American people back, imagine they got it in their lungs and people sit right next to them and pass it on. Man, my goodness. Alright. Let's get on here. Get to the main point. Update. Someone pointed out that in the medical term, if the virus is transferred through tiny droplets in the air, this would technically not be called an airborne virus. Airborne in medical terms would mean that the virus has the ability to stay alive without any liquid carrier. On one hand, This is a question of a cinematic, and the point is well taken. But keep in mind that the only study did not officially determine how the virus travels through the air. It's merely established that it does travel through the air. Dr. Cobonjer hypothesis regarding the droplets of the liquid is just that, a hypothesis for the average person. However, what needs to be understand is very simple. If you're in a room with someone infected with Ebola, you are not safe, even if you never touched them or their bodily fluids. And this is not, hold on, my camera got out of focus. Damn, man. Yeah. And this is not what you are being told by the mainstream media. Essentially, I am using the word airborne as a lay term. So that means this is airborne. If somebody has it, you need to get the hell out of it as fast as possible, out of the house. This thing is a plague. Now, at the end of the video, I'm going to reveal to you how to protect yourself from this plague, and if you get it, how to reverse it and how to heal yourself of this plague. I don't want to use the word cure because, you know, the whole doctor thing. I'm going to show you how to heal yourself from this plague and protect yourself. Very simple. Alright?
To be alarmist, but I'm wondering how much alarm is appropriate. Some people are describing this as the worst outbreak ever.
Well, it's certainly the largest. Extension geographically has been impressive, and it's been going on for about 3 months now, which is certainly longer than we would have expected, and it will probably continue for a while. So this will be the largest outbreak on record.
Its own discoverer calls it a spectacular virus, one of the most lethal, and now out of control in West Africa, according to Médecins Sans Frontières, where the deadliest outbreak on record is spreading like wildfire. And it is gruesome. Most of those who get it will die. According to Médecins Sans Frontières, where the deadliest outbreak on record is spreading like wildfire. And it is gruesome. Most of those who get it will die. Just today, the Red Cross was forced to suspend its operations in southeast Guinea, ground zero for the current outbreak, when a group of armed attackers threatened its health workers there. Ebola was first identified almost 40 years ago, and my guest tonight, Professor pt2. Ebola was first identified almost 40 years ago, and my guest tonight, Professor pt2.
Alright guys, I'm going to show you the secret message of the word oblivion. Oblivion.